I'm Mark with the Anatomy of Wellness, and today I'm joined by Brianna, also with the Anatomy of Wellness. And today we wanted to talk to you guys a little bit more about our new compression therapy system that we have. So we first want to talk to you about what compression therapy is, how it works, and then talk to you a little bit about why you maybe want to use it and how it can potentially help you. And then we also want to give you guys a demonstration of how these work. We have our system set up to some boots here, so we'll throw those on Brianna's legs, and we'll kind of walk through that whole process of what it's like to get set up, and talk a little bit more about how these things can work and help you. So first, I'm going to let Brianna explain a little bit about what compression therapy is and how it works.
Sure. So once you are inside of the compression boots, we turn the power on, and essentially there's different chambers along the boots, and they fill with air. What that does is it compresses your tissues, forcing the blood to circulate through your body quicker than it would without doing something like this. So it really helps with recovery time and kind of flushing out the system.
Yeah, exactly. And that's really why maybe you guys would want to use it, is if you're someone that's participating in strenuous activities, and especially if you're like an athlete who's competing or training, like a marathon runner or someone like that, it can really help to facilitate your body's natural processes that it goes through to help you recover from those activities. So when you participate in strenuous activities, your body goes through all sorts of different things, but one of the things that it does is it produces metabolic waste. And those metabolic wastes can get kind of trapped in the muscles, if you want to think of it that way. And those wastes can actually hinder or slow down your recovery process for your muscles. So what the body does is it brings blood into those areas. The blood will collect some of those wastes, and then it's supposed to deliver that blood back out of the area, and then new blood can come in that's rich in nutrients and oxygen, and that'll actually help facilitate and quicken the recovery of those muscles. So that's what this is doing. It's just helping with that process. Sometimes, especially in our lower legs, that's part of the reason why we have the boots here set up. Especially in our lower legs, our blood can get a little bit stagnant, especially if you're not up moving around. So like on a recovery day, if you're taking things a little bit easier, you're sitting a little bit more, you can get a little bit of that stagnation down through those tissues and through those muscles. So the compression boots just help kind of squeeze that out. If you think of your muscles like a sponge, it's going to squeeze the sponge, kind of drain it of all the blood that's full of those metabolic wastes, and then that'll allow it to suck in or bring in new blood or fresh blood with that's rich in nutrients and oxygen, and that'll help facilitate, improve, and potentially even speed up your recovery. So it's really great for anybody that's looking to improve their recovery, but it's especially great for athletes. So let's give you guys a demonstration of how these work. So we'll throw Brianna in the chair here. We'll put the boots on her. We'll kind of walk you through that whole process, and then you guys can see how these work. Okay, so we want to go through and explain to you guys and show you an example of how it works to actually get set up in the compression therapy system, and show you how it works. So to start, before we actually get anybody in the compression therapy system, like we have Brianna here, the first step really is to go through a questionnaire, a pre-therapy questionnaire. Those are designed to make sure that you're someone that is able to go through compression therapy. Compression therapy is great for a lot of people, but it's not appropriate for everybody. So, for example, if you have any kind of disease that impairs your blood flow, or if you have like congestive heart failure, or if you have like severe skin disorders, things like that, compression therapy probably isn't appropriate for you because it can be dangerous. So, and if you have any questions or concerns about whether or not compression therapy would be appropriate for you, you can always talk to your doctor and ask them. They would be able to help you know that. And then you can also talk to your compression therapy provider, and they would be able to help you with that. But that's kind of what the pre-therapy questionnaire has helped, or is designed to help us with, is just to make sure it's going to be safe for you to do. But after that, we bring someone in and set them up just like we have Brianna here. In Brianna's case, we have her in the boots, which are going to help improve the blood flow of her legs. But there's a lot of different kinds of sleeves for different areas of the body, so it's not always boots, although that's kind of the most common and popular one. Sometimes you'll see them up on people's arms and on their shoulders, things of that nature, but they're all really similar in setup. And again, the boots are the most common ones, so that's what we have here. So the setup's really easy. You just take the sleeves, you put them around the body part that you're going to be working on. So in this case, we have them around Brianna's legs. The boots are made of like a plastic material. They're pretty durable, so you don't really need to worry about stepping in and out of them. They should be able to hold up to kind of any movement that you're doing as you're getting in the boots. But once you get them up around you, you can see there's this big long zipper that goes all the way up the leg. So simply all you do is once you get around the boots around the leg, you just grab this zipper here, and you're just going to zip that up like a big jacket. Up at the top, there's just a Velcro strap that goes over the zipper. And the setup really is that easy. From here, you just have the patient get comfortable. In this case, we'll probably have Brianna recline back because we like to elevate the body part that we're working on to help kind of improve that blood flow up back to the heart. But then from there, you figure out your settings and get the machine started. So that's the initial setup, pretty simple. And now we'll show you what it's like to actually get the therapy started. Okay, so now we got Brianna set up. We got the boots on, we got them zipped up, we got her reclined. She's relaxing like she's on the beach in Mexico or Hawaii or wherever it is that you like to go on vacation and hang out on the beach. But she's just gonna relax, okay? So from here, it's really actually quite simple on how you start the compression therapy. So let me show you the actual system here. So this is the system. It's pretty small, pretty simple. You can see there's kind of these tubes that run down out of the system. These are actually connected to the boots. If you can see this kind of gray lines over here along the side of the boots. So that's where the system is going to pump the air through into the chambers of the boots and fill them up and provide that compression to the tissues. So the system itself though, so really all you need to know is that there's all these fancy buttons and lights and things on the system itself, but it's all to the end of helping us to first get the system started, which is as simple as hitting the power button. And then from here, all you have to do is select how long you want the therapy to last. So for us, we provide sessions of 30 minutes to 45 minutes. Some systems have a setting for a 15-minute session, but we recommend people do at least 30 minutes to 45 minutes to get the most effectiveness out of the therapy itself. So, but you can kind of select whatever you want. Your therapy provider will help you figure out what will be best for you in that sense. And then once you select how long you want the therapy session to last for, you just start the system. And once the system gets started, the patient is able to select how much pressure or how little pressure that they want in the sleeves themselves. So some people like a lot of pressure. They really like to feel the squeeze. Other people can't tolerate it as much and don't like it so much, so you can adjust how little or how much of the pressure you're going to get. So now that we have the system on, I'm just going to set it right back down over here. I'm simply going to start the system. That's going to start pumping that air through these tubes into the boots, and then we'll just let Brianna select how much or how little pressure that she wants. There you go, just that simple. And there's different modes that determine how the boots are filled up and how the chambers progress. So sometimes it'll start at the feet, it'll fill up the feet, and then it'll kind of work up the leg, and it'll get to the point where all the chambers are filled, and then it'll decompress and start over. There's another mode where it just does one chamber at a time and it kind of works itself up. It just kind of depends on what we're trying to accomplish, will determine what mode we're going to use. But typically for the patient, they don't have to worry about that. Usually the compression therapy provider will get that set up for you. But it's really that simple. Turn the machine on, get it started, let Brianna select her desired pressure, and then we would just leave her in here for 30 minutes, 45 minutes. She can hang out, take a nap, and relax. And then as this works, it'll just help increase and improve the blood flow from her legs and help kind of push that blood back up to her heart, get some of those waste products cycling through the body and bringing in that fresh, nutrient and oxygen-rich blood to help her leg muscles recover. So that's really how compression therapy works.